Hello, my name is Garrett DeMille. I want to implement this policy change of the implementation of an Acumen IQ non-invasive hemodynamic monitoring device for all patients going under anesthesia. Many people are already using this for ERAS patients, but I want to implement it for all patients going under anesthesia care to help better identify hemodynamic changes throughout the surgery. So a little bit about this device is it's a sensor that goes on the finger and provides data of hemodynamic changes throughout any surgical procedure or non-surgical procedure. Many changes with the Acumen IQ sensor may be seen in your patients, including a reduce in infection rates, easy integration with the anesthesia machine, it just plugs right in, limits discomfort of the blood pressure cuff continually going off, provides consistent changes with cardiac output, stroke volume, and cardiac index, and provides a continuous reading of the mean arterial pressure. And it lowers complications and length of hospital stays within your patients. As you can see in this picture here to the right, it uses an infrared transmission and an inflatable finger cuff, which then produces the waveforms on the screen. So I want to compare the difference between the traditional blood pressure monitor and the Acumen IQ. So with the traditional blood pressure monitoring, you have pressures intermittently. You will get discomfort with insufflation. You'll be provided with the blood pressure, with systolic, diastolic, and MAP. They're usually really easy to use. Very low cost initially, but you may have more long-term costs depending if you're not getting accurate hemodynamic changes with your patients and their slow data capture. With the Acumen IQ sensor, it's continuous real-time monitoring. It's just on the finger, so there's no discomfort. It provides blood pressure, MAP, cardiac index, stroke volume. It requires extra training and teaching, high costs initially, but patient problems may be caught faster, so you may save the hospital more money in the future. There is a rapid detection of changes in hemodynamic states. So implementing the Acumen IQ sensor will be done in 3 steps: planning, preparing, and implementation. Planning, we will plan out a 6-month period where we will implement the IQ sensor. The first month will be full of team organizations, teaching and question and answerings about the device. We'll have the team reps come and teach the staff how to use it. Month 2 to 4, we will have the Acumen IQ sensor along with the traditional blood pressure cuff, and that will help staff learn how to use both. We will have weekly Q&As with the machine, and an on-site team will be answering questions if they have any. If needed to prolong this step, we could do that. And then the last 5 to 6 months, we'll have a full use of the Acumen IQ sensor, weekly updates on progression and question and answering sessions, and weekly check-in with the team. This will help transition from the traditional blood pressure cuff to the Acumen IQ sensor. Step 2, we will be needing to order the needed machines and devices. To start this, we will be working closely with the preoperative staff and ordering the right amount of supplies they need to set up these for the patients as well. Team organizations set times to teach staff on proper use of the machine while using modules, videos, and live demonstrations. Implementations, staff meeting updates. We will continually have those. We will look at trends on patient statuses and patient satisfaction scores. Representatives there to answer any questions and gather feedback, send out an email with updates on the implementation and how everything is going. So just a summary, the use of the Acumen IQ cuff sensor undergoing surgical procedures will help us effectively provide up-to-date hemodynamic changes for our patients. It will provide easy integration with the anesthesia machine. It will limit discomfort and provide changes in cardiac output, cardiac index, and stroke volume. This will help us give a better insight to our patients' perfusion. This will help save us future cost savings, and this would only take about 6 months to implement. Overall, this will provide better safety for our patients and reduce overall healthcare costs. These are my references, and that is it. Thank you.